what we try to do whenever it comes to changing things around, to utilize technology, to automate workflows, to make workflows, streamlined, is not replacing bodies, but moving the bodies to actually do the job that they're supposed to be doing. So we can take those medical assistants, and instead of them having to go through these faxes and find prescription refills, it's going to be done for them, and they can just help get the prescription refilled. If somebody's nervous about calling in, they can text in, and then we don't need a person to man the phones. We have many people across the entire organization who can answer a chat. You guys have built a chat bot for us that can take care of so many questions beforehand. And so again, it's not to eliminate the people, it's to get them doing things even, at the highest level that they can.
Yep.
So instead of answering the phones, you can work on getting the insurance verifications. You can get another patient scheduled. You can get another patient to see their doctor.
Today we have Cari Ann Bulzone, who's the Chief Operating Officer at Optimus Healthcare, a leading community health center in southwestern Connecticut. Before stepping into this role in Jan 2024, she served as a Chief Compliance and Risk Management Officer at Optimus Healthcare, where she drove initiatives to enhance clinical quality and efficiency. Optimus Healthcare, a federally qualified health center for over 40 years, operates 14 locations and employs over 400 professionals to provide accessible primary care and behavioral health services, making it the region's largest primary care provider. With a master's in marriage and family therapy from Fairfield University, Cari transitioned from being a licensed therapist into a leadership role. So we're going to get into all of this, but thank you for sitting down with us today.
Thank you for having me.
The thing that pops in your mind immediately when you look at your background is you started in this therapy world where, that's where you were studying in college, and now you're, COO of one of the largest FQHCs. How did you make that transition?
Really, I can't sit still, and I can't help but fix problems or be a part of a team that's fixing problems. And so at the first organization that I worked with, we were in the process of trying to optimize our EMR and work on stuff like that. And my mentor at the organization was the chief operating officer at the time. And he was in charge of all of that. And so I couldn't help but ask to help and to be involved. And so that kind of started my journey, so to speak. I've actively saw clients for a few years after that. But seeing kind of how the sausage is made, so to speak, made me want to do more in that area. Transitioning into regulatory compliance, into training, into stuff like that really made me want to do more and more. And I had the opportunity at Optimus to be able to do that. And, and Optimus has been really embracing of moving forward. When you think about FQHCs, a lot of the times when you say that you're a community health center, they think that you're this little clinic, that's just scraping to get by and figure things out, and you're antiquated, and you don't use paper. Like they think that you don't have all this stuff. But Optimus has really allowed me and my team to kind of lean in and do a lot within our organization.
So that's cool. They always say entrepreneurs are people who have experienced their problems and then they go out and solve them, which just sounds like exactly what you sort of went through. When you were on the therapist side of things, what were examples of some of those problems that you were beginning to see that you then wanted to say, hey, let's take a peek around the curtain and see if we can solve these?
Yeah. I mean, getting patients in is first and foremost, right? You can schedule an appointment. That doesn't mean they're going to show up.
Totally.
Being able to talk with them, communicate with them in between, hey, I'm running late, or, something big happened in my life, things like that. So really that two-way communication in between, not necessarily therapy, but just hey, heads up, today's going to be a bad one type of thing.
Totally.
But then on the employee side, right? Just really the electronic medical record being clunky, not being able to track the stuff. Right.
Yeah.
And then as I grew into supervisory positions and director positions, right, is it pulling the reports correctly? Do you have to do, billing in a different location than you do you write your notes and do your encounters and like all that stuff. It's kind of like where everything started.
Yeah. The transition sounds like it makes a ton of sense, but I talk to so many providers that, are in the same position that you were in a long time ago. How did you tactically make that transition? Did you have to take classes on anything? Like, how did you feel confident to make that leap from being a provider to like being in administration?
So in my grad school, while going for my degree in marriage and family therapy, a professor would always say, fake it till you make it.
Got it.
And so I think I embraced that and really just not taking no for an answer and asking for a seat at the table. So a lot of my experience is just lived getting my hands dirty and jumping in and doing the work.
Got it. Love that advice. It's always applicable for many things.
Yes.
But, shifting a little bit into, what we were talking about before we got started, which is, this whole world of AI. And now it's transforming healthcare, which I think is so positive, and there can be so much productivity that comes from this, and turning the system into more of a wellness system. But I understand that Connecticut, which is where Optimus Healthcare is based, is looking at some new restrictions or some new legislation around AI. Talk to us about what that legislation is. And then we can get into, what that is.
So there's a number of bills that are being proposed. And so while it's not necessarily focused on AI in healthcare, it's just AI in general, which trickles down to AI in healthcare. And so, when you read them, it makes sense, right? So one of the first bills that was being proposed is, to put risk management tactics on high risk AI software and things like that, and making sure that anything that is being used is not going to discriminate against patients. It's not going to filter patients. That makes sense. But then it's how you have to manage those things that ends up putting an unnecessary burden onto a health system. And then some other ones is, where they want to, and I apologize, I just got some of this very recently, so I didn't read through it. But some of what I'm seeing for the newer is really taking whatever's going on in AI for smaller industries, such as healthcare. We would be held to the same regulations as like a Google. So that's tough.
Yeah. And places a huge burden. And then the nightmare scenario is that it just is such a significant burden that it like thwarts systems like Optimus from using AI at all.
Exactly. Because, when we have an electronic medical record that has AI built into it, how do you opt out of that? Right? So as the user of the software, some of the legislation is the wording is that like we have to do certain things or we have to keep track of certain things that we would never have access to, right? So it's something that almost you would need to do as the developer. And then that is an undue burden on you because Connecticut's the only one that's saying you have to do it. And so some of the things that we were talking within some associations that I'm in is, you can't opt out of it, right? Nope, I don't want to do that voice recognition, but the automatic rescheduling of canceled appointments, that one's okay.
Got it.
You can't do that.
Yeah. Interesting. And so, in these associations that you're in, you're all probably brainstorming ways to kind of navigate around this AI stuff.
Yeah, well, it's just letting the legislators know where their bills touch, right? Because they're not doing it to be malicious towards healthcare. It's almost, letting them know, like, I know you don't realize or recognize that AI is in your doctor's office, but AI is in your doctor's office.
Yeah. And as a COO, you probably wear a lot of different hats, and you were chief risk before.
Yeah. So I actually hold 2 positions within Optimus. I'm the chief operating officer and the chief compliance officer.
Okay, got it. So talk to us a little bit about what is under the purview of both of those roles.
Yeah. So, I mean, operations is just that, right? We're everything from the time even though it sounds a little bit strange, like from the time somebody thinks about Optimus, right? They're part of operations, to the time that the nurse or the MA brings them back to the room. And then once the doc is done with what they're doing and they come back out, they're back to operations.
Got it.
So operations oversees, how are they able to make their appointments, come in for their appointments, the flow of getting back to the doctor. And then again, we take over after their checkout process. Are they coming in again? Are they staying engaged with us? Things like that. FQHCs also are a little bit different than your regular mom and pop doc, so to speak, and hospital systems, in that we have many services. So we're not just looking at, okay, you saw your primary care doctor, but it's, did you go to the dentist? Did you go to the OBGYN, right? Are your kids going to the pediatrician? Because we have all those services. And so more times than not, they're all in the same building or in the same, really close vicinity. So we know that if someone in the family can come to us, everyone in the family can come to us. And so that's kind of how operations looks at it too, is like, how can we make sure that not only you are healthy, but your entire family's healthy? Got it. And then under compliance, it's kind of truly the back end, but it's making sure that all the patients know their rights. They know what we have to give them, things like that. But then also making sure that all the clinicians are, knowledgeable in what they can and can't do, so to speak. We're tracking everything going on in the federal government. Like, compliance is an interesting place to be nowadays. But then it's also, it's medical records. Like, there's so many little things that fall under compliance. Security falls under compliance. So that way we can make sure that everything is there.
Yeah. So basically every new vendor that works with you guys has to go through compliance. They do. You have to vet them.
Because we have to just make sure that Optimus is protected as well. That verbiage and contracts are correct and all that stuff.
Got it. And, as AI has more and more advancements relevant to healthcare, how do you, with both of your different hats, keep track of everything and say, hey, we got to get this in. We got to start moving towards this direction, given that you have like a million plates spinning.
Right. Well, it's a difficult balance, because the excited person in me wants to run as fast as possible to do all this stuff, because it's new and cool and innovative and really, helps out our staff and our patients. And then the operations side of me is like, wait a second, how much does that cost?
Right. Yeah.
I have to go ask for this money. Is this okay? And then the compliance side of me is like, wait a second, like, are our patients protected? Can we track this stuff? Things like that. So it's almost, I have to like put on a hat and then take off a hat to be able to kind of go through everything.
And our conferences, how do you get your education on, what's even out there? Is it the cold emails that are breaking through? Is it conferences, podcasts? How do you get
so
that?
It's everything and anything, right? So, regarding like changes that are happening now, like I joke with coworkers, if you see me on my phone, I'm on Twitter, like tracking politicians to see like what's going on. Yeah. Like, I swear I'm not just like scrolling for no reason. But then we also have in Connecticut, we have really robust, associations with the different FQHCs. And so, we often talk, we have running threads. So our primary care association gets a lot of information and will pass it down to us. And so, it's kind of like while you're not taking necessarily cold emails, because I don't know who that's coming from.
Yeah.
But it's like I'm getting so much from so many people.
Yeah.
And that helps. There's also,
Yeah.
There's also some professional organizations that I belong to for compliance. There's some of our FQHC associations will assist in getting that information. And so, it's kind of a combination. Sometimes it's me finding it and then going to them and saying, hey, did I just read this right?
Yeah,
And sometimes they're coming and saying, hey, heads up. This is happening.
Got it. Yeah, I'm just asking because, there's a lot of noise in healthcare AI, but there's a lot of really interesting, innovative technologies that
so much
should be adopted by health systems and can be particularly empowering for FQHCs, given the patient population and the margin that you all are working with.
Yeah.
And so, for those sorts of companies, what advice do you have for them to say, if they're like, I need you to hear our messaging, or I need you to see our solution because it will change things for you. What advice do you have for them?
Really to not be afraid of technology.
Yeah.
Right. I think there's a way to get it done. There's a way to get it done properly. You just have to not be scared to look at it, right? Healthcare is not something that has to be antiquated.
Yep.
Right. We have things that we've built with Commure that, allow our patients to just text in and chat with us when they need things and reschedule appointments and schedule appointments and ask questions and get all this stuff. And the idea of doing that a year ago, right, was like, oh no, how do we keep this confidential and how do we make sure that we're not giving out the wrong information and stuff like that. But I think the team that I have working with me, right? Like I have a director of operations who kind of every time I come at him with the idea of, we have to make sure that we are in compliance with XYZ. That's like, his marching orders.
Totally.
Like I will make that happen.
Yep.
And so I think any other FQHC or anyone else in healthcare, so long as you don't accept what you're given, right? Ask the questions, make sure that it works for you and your patients. Like this could work. This could be really possible.
Right. FQHCs sort of face notoriously tight budgets, right? Like you and your team definitely have these pretty strict lines that you have to operate within. Sure. And I think, Optimus Healthcare is thriving in spite of all of those tight budgets, budgetary constraints. What are some pretty interesting innovations that you all have deployed inside Optimus Healthcare, that are that kind of punch above its weight?
Sure. So we're trying to just streamline workflows, right? So something that we're actually starting to work on with your team is like, and it's the smallest thing, but it's figuring out our faxes when they come in, right? You need a person to do that right now. You need many people to do that right now. And those people could be helping patients.
Yeah.
So what we try to do whenever it comes to changing things around to utilize technology to automate workflows, to make workflows, streamlined, is not replacing bodies, but moving the bodies to actually do the job that they're supposed to be doing.
Yep.
So we can take those medical assistants, and instead of them having to go through these faxes and find prescription refills, it's going to be done for them, and they can just help get the prescription refilled. If somebody's nervous about calling in, they can text in, and then we don't need a person to man the phones. We have many people across the entire organization who can answer a chat. You guys have built a chat bot for us that can take care of so many questions beforehand. And so again, it's not to eliminate the people, it's to get them doing things even, at the highest level that they can.
Yep.
So instead of answering the phones, you can work on getting the insurance verifications. You can get another patient scheduled. You can get another patient to see their doctor, like things like that. So we're trying to take, instead of going huge and looking for, the program that they have, there's a program in Europe where, you can be screened by this computer and then you're ready for the doctor. We're not looking to eliminate people, right? We're looking for those small pieces throughout the day that are a pain and that take time. And how can we automate that, or how can we make that better utilizing technology so that way you can go work?
Got it. So you've probably thought about this, given that you like live and breathe it all the time. But, if you were to take a step back and sort of think, what would the ideal patient experience be from what you're saying, when a patient thinks about Optimus Healthcare to, when they come in and when they leave and, tell their family members about it. What would you like that workflow to look like? It doesn't have to be stuff that you have today. It could be stuff that you wish you had.
Right.
Maybe that stuff that doesn't exist yet. But what would that look like?
So, there's two different people coming in, right? So we have our patients that also embrace technology in the same way we do. So the idea is that if you're looking for us, you can find us easily, right? We're going to wave that magic wand for that. And then you can schedule that appointment easily. You can get the information that you need super quick, whether that's chatting with us or calling us. But then once you come in, you're able to register. And so here's where we get the divide of the two different patients, right? The patient who embraces technology, use a kiosk, right? Go and just and take care of it yourself. And then the nurse or MA comes out and gets you. The doc has everything that they need. All of our technology that we use, screening tools feed right into our EMR, which sometimes is not the easiest thing to find. We're using ambient AI to help write the notes, things like that. And then after you leave, getting some follow-up messages from us where saying like, how was your experience? What do you need better? What could we have done better? What do you need following this? Maybe a few weeks down the line, how are you feeling? Are things good? And then the patient that does not embrace technology, having them feel comfortable too, right? So the same thing, they find us as they want, they make their appointment, they're probably going to call, they're not going to chat us. We also have patients that just walk in, so they're able to walk in. And because of the individuals that embrace the technology, there's more time for that person who doesn't want to use a kiosk to go talk to a front office rep, right? And then the patients have the same exact experience going through, but it's how they want their experience to be. Right. And sometimes it's all or nothing, right? You see, not that we're thinking of doing it, but sometimes you see, it's kiosk or nothing. It's people or nothing. And so whenever we try to do things, it's constantly making sure that we can meet both individuals.
No, that is one of the best answers that we've gotten on the series. I like to ask that question to everyone that comes on. But I think it makes sense. It's a gradient, it's a spectrum. Like you have to meet patients where they are, and everyone, especially in an FQHC, you have such diverse backgrounds. And so you really, the main thing is that you just deliver care in the most efficient way, but totally, the considerations you have for the patient make a ton of sense. What's the most unconventional strategy that you all at Optimus Healthcare have deployed? There's a lot of staffing shortages now. They're crippling healthcare. In terms of how are you guys trying to retain talent, build a resilient workforce?
So I don't know if we're doing anything like super out of the box. But we're willing to try anything that we can. So our clinicians had expressed wanting dictation. So we were looking into dictation. We hear that it's clunky. A lot of our clinicians didn't like it. Reviews were not so great. And so now we're utilizing the ambient AI technology that's within our EMR. So that way, that increases clinician satisfaction, right? So that's different. It's not necessarily, super out of the box, but what we do for staff satisfaction is really just try to listen to them and figure out a way to get it done, right? So, I often will say like happy clinicians make happy patients, like as silly as that sounds, right? But if you go to your primary care doc and they're grouchy because their medical record just crashed, you're not going to have the best experience.
Yeah.
This is not going to happen.
Yeah.
And so like, will you schedule that follow-up? Will you do this? I don't know. But like if your clinician doesn't care about what's going on behind them because it's just working, they're going to spend more time with you. They're going to chat with you more. They're going to be genuine. They're not going to be, they're not going to be cranky. And then patients come back because they want to come back. And so I think one of the things that we're doing at Optimus Healthcare that I don't know if everybody does is as soon as we get a problem across our desk, the first question that we ask is, can technology help this? Can technology make this better? Before we look at people, before we look at dollars, before we look at anything, we go, how can we use technology? Do we have it already? Do we need to reach out to have it built? Is there some place we could buy it from? Then we figure out if we could afford it. The first question is always, can technology help this?
Yeah. I think that's so interesting because it's like, it's different than being a physician and having all the pieces working, and a physician not being their best at their job is so different for them because it can impact a patient's like health journey, you know, like, and you just want, like, the goal is you just want to provide the same fantastic healthcare to every single patient, which is almost like a machine, but these are doctors, these are humans at the end of the day. They have, bad days, and they, but the goal, and ideally with technology, what we can do is we can just create like that normal where it is just excellent healthcare, and you have all these different resources that help the doctor's productivity, regardless of any fluctuations that they have in their day that a human would. That's so interesting. FQHC funding is super unpredictable. What's one of the out-of-the-box revenue streams that Optimus is pursuing, and how do you think it can redefine financial stability for the community health centers?
So we're looking into, one of the things that we're doing at Optimus Healthcare that every time I tell somebody that we have it as an FQHC, they always go, oh, really? Wow, you never hear that, is we have fully embraced specialties as far as, chiropractic care, acupuncture care, podiatry. These are areas that not all FQHCs have because they don't have to. And so that's something that that we are always looking at, right? Whether, so our patients can access anything and everything, right? So nothing's off the table, right? So we've floated, do we open up our own pharmacy? Do we open up an ophthalmology clinic? Like, what can we do to kind of keep our patients in-house? Not just for the revenue, but for the revenue as well. But, FQHCs serve underprivileged communities. And so it's not easy for them to just get up and go to the chiropractor, right? They're not gonna think I can go get acupuncture, right? So a lot of it is so much education, but I think that's some of the things that we're really leaning in on. And so it's difficult for us because the funding's not really there, because those things aren't fully reimbursed as an FQHC because they're add-on services. And so, do we pull it out of scope, and then we can do things parallel to being an FQHC with a particular structure. And then maybe that can make it a little bit more financially stable. Do we just do like this gangbusters campaign to make sure all of our patients know we have these services? And so if the reimbursement's a little bit lower, that's okay because we're getting people in, things like that. So I think that's some stuff that we're doing. But we're also looking at how can we, potentially outsource things to other companies, which will then, could free up some finances to then be able to kind of do more with our staff that we have.
Yep. And it sounds like one of the big things for your Optimus Healthcare is getting patients in, new patients, as well as existing patients, having them come in for, their preventative health visits, et cetera. What are some of the strategies that you guys are deploying to get some of that traffic?
So in working with Commure, we have health campaigns, we have texting with them. So we're trying to be as in your face, but not obnoxious as possible, right? Hey, it's flu season. Don't forget. It's back to school. Did you get your physical? And then like random, it's Heart Health Month. This is some stuff that you should be aware of, or healthy recipes. We also have nutrition. That's right. I forgot that before. And so we're trying to have our patients, have our community look at us as more than just the doctor's office. Where they can come to us for other things. FQHCs also provide wraparound services. So we have community health workers that can help provide things that a lot of doctors' offices don't, and health systems don't. And so it's letting them know that. And so, we'll send out, messages to our pediatric patients on, a Wednesday, because we have Saturday hours in pediatrics, saying, hey, don't forget, if your kid's not feeling well, you can come see us on Saturday. Just give us a call or respond to this text message. If there's, bad weather coming up, heads up, there's bad weather coming up. If you need to reschedule your appointment, reach out to us beforehand so that way we can get you in quicker.
Totally.
So it's really trying to anticipate some of the stuff that they need, but then also kind of just being back there in the background, letting them know.
Totally.
Like, we're here.
Totally. And then what about for new patients?
So for new patients, we're kind of just letting everybody know that we're here. We try to not be super pushy. We have a great team of individuals that go out into the community, and anytime there's an event, they have a table. And so we're just kind of not lurking. I don't think that's the right word, but we're just, I saw Optimus, and then you see us next week. Oh, and I saw, what do you do? Right?
Yeah.
And so, I don't think it's not sexy to be like, hey, we're your primary care doctor. Hey, we're your OBGYN. So it's more of just, you see us so often that you go, oh, that's right.
Got it. Yeah.
I remember during that walk, I saw that doctor, that type of thing. And it's hard to keep calling us a doctor's office because we're not necessarily a doctor's office, but I feel like that's how people, I have to
maybe Commure and Optimus Healthcare should do a joint billboard in the area. That would be kind of cool. Federally health qualified centers really are healthcare's hidden MVPs. Some of my most rewarding experiences working here have been working with underserved communities, oftentimes part of FQHCs. Tell us some of the most incredible stories from the last couple of years in respect to serving these communities.
It's really just helping people get the care that they need. We've had patients go into labor in our units. Yes. And our doctors and nurses and MAs have been fantastic at helping. We've had, babies come in that you think don't feel well, right? Because newborns, but are actually a lot sicker than you anticipate. And so the team rapidly responding and getting them over to the hospital and getting them the care that they need. But then also like the patients that are just upset, right? Something went wrong. And so then so they call us and they're like, rightfully telling us what we did wrong, and us being able to correct it and then change their perception of Optimus to where they're going to come back. And so those have been the most impactful, being able to really see patients get what they need. And it sounds silly to look at it from like the numbers side, but when we see that our patient count goes up, then we know that our community is getting healthier.
Yes.
And so it's constantly making sure we have access. It's constantly making sure we're open when they need us. And then listening when they tell us something's wrong.
Yeah.
So
interesting. And as COO, how do you know when, you've had an amazing year and you really, you're like, I really did my job well this year. What does that look like for Optimus Healthcare?
That's a great question. I don't know if it's any one thing. I think it's a whole bunch of things. I think it's patients being happy. I think it's our staff being happy. It's our numbers being positive, which is always a plus.
Totally. Yeah.
But it's also just the atmosphere when you walk through our buildings, right? So when you're greeted with a huge smile at the front office, when the docs want to talk to you while you're walking through, things like that, that really tells us like we're doing our job, right? Like this was a good year. We do shout outs where anybody in the organization can email our CEO and give her, a shout out, and she will resend it out to the entire org. And when you see those ticking up, then you know you're doing something right. Like last Friday, I think she sent out 3 or 4.
Awesome.
Then when people are happy, they're going to do really awesome things. And when people are happy, they're going to recognize who else is doing awesome things. And so I think seeing all of that and pieces of that throughout really tell us that we're doing our job right.
Awesome. And then, we always end with this segment on extra time in your day. So if your team didn't have to deal with insurance, hours of documentation, labor-intensive admin tasks, how would your quality of life change for your colleagues at Optimus Healthcare?
I think it would greatly increase because they would be able to talk to patients. They would be able to be out in the hallways, in the waiting room, talking to patients, helping patients, getting feedback from patients, and then getting out into the community too and letting them know that we're there. And so I think that's something that is gigantic. That while we don't have a magic wand to make everything, but through our partnership with Commure, we've been able to give them a little bit piece of that back, which has been fantastic.
Great. Well, Cari, we appreciate your partnership. Commure is grateful and privileged to be working with Optimus Healthcare, given all the amazing work that you all are doing. And we look forward to having you on again.
Thanks so much.
Thanks.